more care plans. The patient problem would be compromised skin integrity related to inadequate nutritional intake. So you want to assess for nutritional intake, explain the importance of nutrition, provide adequate protein, vitamins, minerals, and fluids. So the patient problem is potential for infection related to impaired skin integrity. You want to assess the wound daily, including size, location, and depth. Obtain wound cultures if appropriate. Follow strict aseptic technique when performing wound care per the healthcare provider's orders. Use photographs to document healing or changes in pressure injuries. Gastrointestinal system. A balanced diet provides fuel for the body. Good nutrition is essential to health, function, and quality of life, regardless of age. An inadequate or imbalanced diet can be tied to numerous chronic conditions, including obesity, hypertension, diabetes, cancer, and cardiovascular disease. Older adults may experience a reduction in the sense of taste and smell. Medications may alter the taste of foods or result in a decrease in saliva production. Older adults living alone may report a lack of interest in preparing solo meals or may have limited financial resources to obtain nutritional foods. These occurrences contribute to undernutrition. Inactivity, boredom, and mental health concerns may result in excessive food consumption. This may result in overnutrition. Assess the patient's nutritional status. Interventions for nutritional issues can help the older adult attain higher self-esteem, improve physical well-being, and a better quality of life. Age-related changes. Older adults have decreased secretion of saliva and a diminished gag response, which increases the chances of choking and aspiration. In addition, many medications taken by older adults may compound the problem by further reducing saliva production. The stomach of the older adult has decreased gastric motility as well as decreased production of bicarbonate and gastric mucus. Aging also can cause decreased production or lack of production of the intrinsic factor, causing the body to become unable to use ingested vitamin B12, leading to pernicious anemia. Enzymes in the intestinal tract are also altered. The abdominal wall becomes less firm and abdominal muscles weaken. Decreased tone of the intestine occurs, and it is common for peristalsis to become slower, leading to increased constipation. The normal changes of aging often are intensified by medications commonly prescribed for other conditions, lack of fluids or dietary roughage or fiber, and lack of exercise or activity. Liver function often decreases, making drug metabolism less efficient. Assessment. You want to assess oral cavity for the presence of lesions, dental caries, loose, broken, or missing teeth, dentures that do not fit well, edematous gums, and halitosis. Assess the ability to chew and swallow. Assess for reports of heartburn and nausea. Assess dietary intake, especially of high-fiber foods, fat, and sodium. Note amount and type of food and fluid intake. Assess appetite. Assess weight, compare with norms, and monitor for significant changes. Assess frequency, amount, odor, and consistency of bowel elimination. Assess abdomen for tenderness, distension, and active or diminished bowel sounds. Ask about intestinal cramping. Assess individuals' ability to control defecation. Assess bowel elimination routines and use of laxatives. An annual fecal occult blood test is recommended for older adults above 50 years of age for detection of colorectal cancer, the second leading cause of cancer deaths in the United States. A stool DNA test may be completed for detection of colorectal cancer. Common concerns in nursing interventions. Obesity, defined as weighing at least 20% more than ideal body weight. Obesity is common in older adults. Older adults should consume less food than they did in their earlier, more physical, active years. Adults 75 to 90 years of age need approximately 30 calories per kilogram of body weight, 14 calories per pound, compared with 40 calories per kilogram, 18 calories per pound for people 20 to 37 years of age. This normally represents a diet of 1,800 to 2,400 calories daily, depending on gender and ideal weight. Along with fewer calories, older adults need to consume quality foods such as grains, veggies, fruits, which contain vitamins, minerals, roughage, and fiber, to meet their daily needs without large amounts of sugar and fat. They also need foods that provide protein and are good sources of calcium. Some foods are not as well tolerated because of changes in the digestive tract or difficulty with chewing or swallowing. Individual food preferences should be respected. A well-balanced diet is generally accepted as adequate without vitamin supplements. Vitamin A, C, and E, and niacin may help slow the aging process, counteract the effects of free radicals, and extend life. Vitamin A, C, and E. ACE. Okay. Weight loss. Gradual weight loss over time is a normal response to loss of body mass. This typically occurs with changes in body composition of fat, muscle, and fluid. Decreased nutrient intake in aging because of decreased appetite, lower metabolic rate, and diminished energy output also produces weight loss. Rapid weight loss may indicate an illness and should be reported to the healthcare provider. Unexplained weight loss totaling more than 5% of weight in 6 months to a year necessitates a medical evaluation. Fluids and dehydration. Fluids are necessary for the body to function and to remove the waste products of metabolism. An older person needs a minimum of 1,500 ml of fluids daily. Because of arthritis or other conditions, some older adults have difficulty pouring liquids and drinking from a cup. Older adults sometimes decrease their fluid intake to control incontinence or because of an illness such as heart failure. When fluid deficit is caused by the older adult trying to control incontinence, the most appropriate intervention are to make fluids readily available and toilet facilities more easily accessible. Arranging the room so that access to the bathroom is unobstructed often helps. Sometimes the older adult needs assistance to the bathroom on a schedule, usually every 2 hours during working hours and every 4 hours at night. If needed, a commode or urinal should be placed where the person can easily use it. Older adults who have difficulty picking up a cup or bending the neck often find that an adapted cup with a double handle or a cutout for the nose is a good solution. Some older adults who are disoriented likely need to be prompted to drink. Those with severe impairments often must be assisted to drink fluids on a scheduled basis. I'm sorry. Okay, oral hygiene. Loss of teeth often is assumed to be normal in old age, but this is a misconception. It is not part of the normal aging process. Many of today's older population matured before the introduction of many modern methods of dental prophylaxis, which affects their dental health in addition to individual oral hygiene habits and the possibility of untreated periodontal disease. In the future, with good oral hygiene practices throughout life, many people will maintain their natural teeth for life. Missing teeth make chewing difficulty and tiring. Loose-fitting dentures tend to make chewing difficult and often allow food to collect under the denture, resulting in lesions. Both of these problems decrease a person's desire to eat. Oral hygiene is essential to eliminate debris that has the potential to interfere with taste or cause lesions. Recommended mouth care for older adults consists of a thorough cleansing of the entire mouth with a soft bristle toothbrush or foam stick applicator in the early morning and at bedtime. Mouth care is also important when an older adult has dentures. In addition to cleaning the dentures, brush the gums and the tongue and rinse the mouth. If dentures are damaged, lose or exert pressure on the oral mucous membranes, refer the person for dental services. Loss of appetite. Older adults frequently experience a loss of appetite. Changes as a result of decreased saliva production and a decreased number of taste buds sometimes make food unappealing. Gastric motility slows because of the loss of smooth muscle in the stomach, which causes a delay in emptying time, distension, and early satiety, fullness. Anorexia and weight loss often result. In addition, many medications taken by older adults can produce side effects such as dyspepsia, nausea, vomiting, anorexia, diarrhea, and constipation, which affect the appetite. Interventions to counteract the lack of taste buds or the lack of interest in eating may include preparing food with color and garnishes, using attractive dishes and table settings with good lighting and bright colors, and providing foods that have more seasoning if there are no restrictions. Encourage the patient or caregiver to prepare homemade frozen dinners from extra proportions of a favorite meal as an easy and effective way to provide a meal that will be enjoyed. Individuals who have impaired mobility or activity intolerance that interferes with the ability to prepare food may benefit from community-based programs such as Meals on Wheels or home-delivered meals from a senior nutrition site. In addition, a wide variety of fresh canned and frozen food in a small or single serving is available in stores. Older adults should check the sodium content in canned or frozen to avoid consuming excessive amounts of sodium. For most individuals, eating also is associated with a social setting. Dining alone may make eating less appealing. When an older individual has lost a spouse or is unable to leave the house, despair, grief, and social seclusion are patient problem statements to be considered. Interventions that may assist the older adult in improving nutritional intake include community meal programs, church dinners, or senior citizen programs that provide transportation, meals, and opportunities to socialize. Gastric reflux. Reflux occurs when the sphincter at the opening of the stomach becomes less efficient, which allows food and digestive enzymes to flow back into the esophagus. Symptoms include heartburn, sour stomach, and regurgitation of sour, bitter material. Reflux can be controlled by eating small meals, avoiding eating before bedtime, and elevating the head of bed. Achieving and maintaining ideal body weight are also helpful. Food intolerance. Lactose, primarily found in milk, is a common source of a food intolerance. Dairy products are an important source of calcium. Which is needed to prevent osteoporosis. Lactose intolerant individuals may need to replace milk with cheese and yogurt, which is processed and easier to digest. Dysphagia. Difficulty swallowing may arise from many possible causes, including a stroke or other neurologic dysfunction, local trauma, and obstruction with a tumor. Assessment should focus on whether the dysphagia is with liquids, solids, or both, and on the time frame for the progression of the symptoms. The older adult often has more difficulty swallowing fluids or foods that contain firm foods in liquid, such as soup, than swallowing semi-solid or solid foods. Interventions for individuals who have difficulty swallowing include avoiding liquids, positioning, and verbal coaching. Thickeners can be added to liquids to improve the ability to control swallowing. The upright position, leaning slightly forward with the chin down, enlists the assistance of gravity to improve swallowing. Placing food on the unaffected side reduces distractions in the room. And cueing the person to swallow are other ways to facilitate success. Patient problems and interventions for the older adult with gastrointestinal systems changes include but are not limited to the following. Compromised swallowing ability related to neurologic or vascular conditions. Refer to speech therapists for evaluation. Assess individuals' unique needs and problems. Verify condition of teeth or fit of dentures. Assist to sitting position with chin flexed toward chest. Allow adequate time for meals. Feed slowly. Give frequent verbal cues to swallow. Reduce distractions during meals. Keep suctioning equipment available in case of problems. Insufficient nutrition related to lack of interest in food. Assess the reason for loss of interest, such as depression or grief. Monitor daily intake. Weigh them weekly. Determine individual food preferences. Provide oral hygiene before meals. Serve meals in an attractive manner. Assist as needed. Supplement meals with nutritional snacks. Supplement meals with nutritious snacks if permitted. Consult with dietitians or provide a social interaction during meals.